As we age, our bodies change, and so does the way they signal distress. Nowhere is this truer than with heart attacks, myocardial infarctions, in individuals over 60. What might be dramatic chest-clutching pain in a younger person can often manifest subtly, quietly, or even deceptively in seniors. This understanding is crucial because heart disease remains the leading cause of death globally, and timely recognition is the single most critical factor in survival and minimizing heart damage. Let's explore the top 5 heart attack symptoms for seniors, explaining not just the what, but the vital why behind their presentation in an older body. Why are heart attack symptoms different in seniors? Before diving into the symptoms, understanding the why is essential. Silent nerve changes. Over decades, nerves, including those carrying pain signals from the heart, can become less sensitive due to aging, diabetes, common in seniors, or previous minor heart damage. The heart's distress signals simply don't get through as loudly. Coexisting conditions. Comorbidities. Seniors often manage multiple health issues like arthritis, chronic lung disease, COPD, indigestion, or diabetes. A new symptom can easily be mistaken for a flare-up of an existing problem. Pain might be attributed to arthritis, shortness of breath to COPD, or nausea to a stomach bug. Higher threshold for pain. Years of experiencing various aches and pains can lead some seniors to downplay new sensations or dismiss them as just getting old. Silent ischemia. Seniors are more prone to developing coronary artery disease gradually. The heart muscle might become accustomed to reduced blood flow, ischemia, without triggering classic pain signals until a major blockage occurs. Altered pain perception. Neurological changes associated with aging can affect how pain is perceived and located within the body. Medication effects. Certain medications, like beta blockers, can mask the heart rate increase often associated with a heart attack. Pain medications might dull other sensations. The top 5 symptoms, decoding the body's signals. Here are the most common and critical heart attack symptoms in seniors over 60, explained with an emphasis on understanding their presentation. Unusual fatigue or profound weakness. What it looks like, this isn't just feeling tired after a busy day. It's an overwhelming, crushing exhaustion that comes on suddenly or severely worsens existing fatigue. Simple activities like walking to the bathroom, making a cup of tea, or even sitting up in bed feel like monumental tasks. It may persist for days leading up to the event. Why it happens. The understanding part. Your heart is a pump struggling to do its job. During a heart attack, a blocked artery starves a portion of the heart muscle of oxygen-rich blood. This damaged muscle can't contract effectively. Think of it like a battery running critically low. The whole system, your body, lacks the energy to function normally. The heart has to work much harder to try and compensate for the damaged area, consuming immense energy and leaving little for anything else. This profound fatigue is the body diverting all remaining resources to keep the vital pump going, at the expense of everything else. Why seniors might miss it. Fatigue is incredibly common in older age due to many factors: less activity, chronic illnesses, medication side effects, or simply the aging process itself. It's easy to brush off this new level of exhaustion as just a bad day or part of their usual condition. The suddenness or severity is the key red flag often overlooked. Shortness of breath, dyspnea. What it looks like, difficulty breathing that occurs unexpectedly, without significant exertion, or is significantly worse than usual. It might happen at rest, wake someone from sleep, or occur with minimal activity like getting dressed or talking. It can feel like not being able to get enough air, suffocating, or needing to gasp. Why it happens: the understanding part. The damaged heart muscle pumps blood less efficiently. Blood backs up into the lungs because the left ventricle, the heart's main pumping chamber, can't push it forward effectively. Fluid leaks into the lung tissues, pulmonary edema, making it harder for oxygen to cross into the bloodstream. Imagine trying to blow up a balloon filled with wet sponge instead of air. It requires immense effort for little result. Additionally, the body senses low oxygen levels and triggers faster breathing, which feels like breathlessness. This symptom can occur with chest discomfort or completely without it. Why seniors might miss it: shortness of breath is a hallmark symptom of common senior ailments like COPD, asthma, pneumonia, or heart failure. It's easy to attribute new or worsening breathlessness to one of these conditions rather than recognizing it as a sign of an acute heart attack. The context: sudden onset, occurring at rest, or disproportionate to activity, is critical. Chest discomfort, often atypical. What it looks like: while the classic elephant on the chest crushing pain can happen, seniors are far more likely to experience pressure, tightness, or squeezing, a persistent feeling like a heavy weight, vice, or band around the chest. Often described as discomfort rather than sharp pain. Aching or dull pain, similar to indigestion or muscle soreness. Location variations: pain might not be center chest. It could be in the upper abdomen, mistaken for heartburn, the back, especially between the shoulder blades, the jaw, neck, or either shoulder/arm. Right arm pain is surprisingly common in seniors and women. It might radiate to these areas from the chest or start there directly. Duration usually lasts more than a few minutes. It may come and go, but the pattern feels ominous. Why it happens: the understanding part. The blockage prevents oxygenated blood from reaching heart muscle cells. These cells start to suffocate and die, releasing chemicals that irritate nerve endings. The vagus nerve, which runs from the brain through the chest and abdomen, carries these distress signals. Because this nerve serves multiple areas: heart, esophagus, stomach, neck, jaw, the brain can misinterpret the source of the pain, leading to referred pain in the jaw, arm, or upper abdomen. The dullness or pressure sensation often reflects the nerve sensitivity changes discussed earlier. The signal isn't sharp, it's muffled. Why seniors might miss it: this is the prime example of symptom masking. Upper abdominal discomfort screams indigestion or gallbladder. Back pain is often arthritis. Jaw pain could be dental. Arm pain might be bursitis. The lack of dramatic, central chest pain leads many seniors, and sometimes even clinicians, to initially dismiss it. The key is any new, unexplained, persistent discomfort in these areas, especially if combined with other symptoms like sweating or shortness of breath. Unexplained nausea, vomiting, or indigestion. What it looks like: feeling suddenly queasy, needing to vomit, or experiencing persistent indigestion/heartburn that doesn't resolve with antacids or usual remedies. It might be accompanied by cold sweats. Why it happens: the understanding part. Remember the vagus nerve? When the heart muscle is distressed, it heavily stimulates this nerve. The vagus nerve plays a major role in controlling the digestive system. Overstimulation triggers nausea, vomiting, and sensations mimicking severe indigestion or heartburn. Additionally, the significant stress of a heart attack on the entire body can directly cause nausea. Why seniors might miss it. Digestive issues are incredibly common in older age: slower digestion, hiatal hernias, acid reflux, side effects of medications. Reaching for the antacid bottle is a natural reflex. This symptom is particularly deceptive because it feels so distinctly gastrointestinal. The unexplained and sudden nature, especially if it feels different or worse than usual indigestion, and its association with other symptoms, like weakness or sweating, are vital clues. Lightheadedness, dizziness, or sudden confusion. What it looks like: feeling faint, unsteady, or like the room is spinning. A sudden, unusual episode of confusion, disorientation, or fainting, syncope. Why it happens. The understanding part: when the heart is damaged and can't pump effectively, blood pressure can drop significantly. This reduces blood flow to the brain. The brain, starved of oxygen and glucose, malfunctions, leading to dizziness, lightheadedness, fainting, or sudden confusion. An irregular heart rhythm, arrhythmia, which is very common during a heart attack, can also drastically reduce blood flow to the brain, causing these symptoms. Why seniors might miss it. Dizziness is another common senior complaint, often due to inner ear problems, medication side effects, dehydration, or orthostatic hypotension, blood pressure drop on standing. Confusion can be mistaken for a senior moment, the onset of dementia, a urinary tract infection, UTI, or a medication interaction. The sudden onset is critical. A senior who was perfectly clear-headed moments ago becoming confused is a major red flag. The critical overarching message: silent doesn't mean harmless. It's vital to understand that silent heart attacks, those with minimal or no noticeable symptoms, are significantly more common in seniors. Damage is still occurring to the heart muscle. These are often only discovered later during routine ECGs or tests for other reasons. The symptoms listed above, even if subtle, are the body's best attempt at an alarm bell. Why immediate action is non-negotiable. Time is muscle. Every minute a coronary artery is blocked, more heart muscle dies. This damage is permanent and weakens the heart, leading to heart failure and other complications. Treatment saves lives and function. Modern treatments like clot-busting drugs, thrombolytics, and emergency angioplasty with stenting are incredibly effective at reopening blocked arteries, but only if given quickly. The sooner treatment starts, the more muscle is saved, and the better the long-term outcome and quality of life. Complications. Delayed treatment increases the risk of dangerous complications like severe arrhythmias, like ventricular fibrillation, which is often fatal without immediate defibrillation, cardiogenic shock, where the heart can't pump enough blood, and heart rupture. What should seniors and caregivers do? Know the symptoms, especially the atypical ones. Familiarize yourself thoroughly with the 5 symptoms above. Print them out. Discuss them with your doctor. Don't dismiss or downplay. If you experience any new, unexplained, persistent symptom from this list, especially more than one occurring together, e.g., unusual fatigue and shortness of breath, nausea and chest pressure, do not ignore it. Don't chalk it up to old age or assume it's your usual arthritis or indigestion. Err on the side of caution. Act immediately. Call emergency services 911/999/112, etc. Do not drive yourself to the hospital. Do not wait to see if it goes away. Do not call your primary doctor first, they will tell you to call 911. Call emergency services, ambulance, immediately. Paramedics can start life-saving treatment en route and alert the hospital, speeding up care dramatically upon arrival. They are equipped to handle cardiac emergencies in transit. Chew an aspirin, if advised and not allergic while waiting for the ambulance. If you are not allergic to aspirin and don't have a condition that prohibits it, like active bleeding, chewing 1 adult aspirin, 325 milligrams, or 4 baby aspirins, 81 milligrams each, can help by making blood platelets less sticky. But only if emergency services advise it or it's part of a pre-discussed plan with your doctor. Never delay calling 911 to find aspirin. Inform the dispatcher/paramedics. Clearly state you suspect a heart attack and list your symptoms. Mention if you have known heart disease. Conclusion: empowerment through understanding. For seniors over 60, a heart attack often whispers rather than screams. Unusual fatigue, unexplained shortness of breath, atypical chest/upper body discomfort, sudden nausea or indigestion, and lightheadedness or confusion are the body's critical, albeit sometimes muffled, distress signals. Understanding why these symptoms occur, the aging nerves, the competing health issues, the heart's struggle to pump, and the brain's misinterpretation of pain, is key to recognizing them. This knowledge is empowering. It moves beyond fear to preparedness. By knowing these signs and committing to immediate action without hesitation or self-doubt, seniors and their loved ones can dramatically improve the chances of surviving a heart attack with minimal heart damage. Listen to your body, trust your instincts, and remember, when in doubt, call it out. Dial emergency services immediately. That call could be the most important one you ever make. Hope you enjoy the video. Please like, share and subscribe.